evening and thank you for joining us. We are coming to you from the Athena Hotel in Bukolobi. And tonight we're going to be speaking about scoliosis. And I have with me in the studio one Zamzam Nalugo, who is coming to share her story about how she's coping. And also we have Dr. Frederick Mutiaba, who is a consultant orthopedic surgeon with Nsambia Hospital, and he'll be sharing with us in detail about what scoliosis is and how it comes about and treatment and all of that that we'd like to know about it. So let's quickly say it as it is. Once again, thank you for joining us. And tonight we have Zamzam in the studio and would like to hear your story, Zamzam. Where does your journey with scoliosis begin?
My journey with scoliosis began when I was around 8 years, according to the pictures I see of my time back. Yeah, around 8 years I had uneven shoulders. It's one of the signs of scoliosis, but I never experienced any pain. I just used to live a normal kid until my Form 2. In my Form 2, it's the adolescent stage. Initially, I had a surgery around here. I had a surgery. So in my Form 2, I used to over-complain to my mom. I was like, Mommy, I'm not feeling well. I feel like these scars are tearing apart.
What was the surgery for? The one you had?
She said I got flu when I was a kid and I had water in my lungs. They had to remove that water. It was a very long process, being admitted from hospital to hospital until I felt better. Yeah, she spent that was around 2 years. And after that I lived a normal kid, just a little bit sickly, but alhamdulillah. Till my Form 2, as I had said, I used to feel like my scars were stretching. I used to over-complain and she could smear Vaseline on them. Little did we know that this hump was developing. So until she took me to a certain doctor from Masaka Referral Hospital. This doctor had me for x-rays. Then they used to say scoliosis. They never explained anything to us as what is scoliosis, what could come out of scoliosis. They never said a word. Since then, I started growing. I used to feel so insecure as far as my back is concerned around that time. Until things started coming. I couldn't stand for a long period of time as far as the assembly is concerned, assembly time. Then I was given a brace, which I wore for a very short period of time because I outgrew it. And then it got broken. But then it was still very expensive to replace one.
So this was a brace for your back?
Yes. They had measured me and then it could hold me out not to feel pain at a certain point. But it was very, very uncomfortable.
So you started feeling pain?
Yes. It was very, very uncomfortable because it used to hold me not to feel a lot of pain. I could be with it from morning till evening.
Do you remember what kind of pain it was? Was it excruciating pain? Was it just pain from when you're in a certain position for a long time?
Yeah, in a certain position for a long period of time. Actually, after making some research about myself, I realized I used to be a very sleepy kid. During high school, I used to sleep during classes. I could find myself slouching like this just because I can't sit like this for a long period of time. Yet at the end of the day, you're advised to sit straight. Not this curve to worsen, but then you can't help it because you're trying to find somewhere where you can feel a little bit comfortable. That's what happened.
So since nobody explained to you what scoliosis was,
yeah.
How did you eventually begin to understand what was ailing you?
I told you, I used to hear doctors saying that I didn't know what it was all about until around my first year. My first year, things became so bad. The other time I used to feel pain, but I could really stand the pain. My first year, it became so bad, and then I had to do some research about myself. It was like I had this doctor saying scoliosis, what could be the problem? Then after, because I reached a certain time, I couldn't do anything for myself. I couldn't wash, I couldn't do anything. Could just sit there. Sometimes I could miss lectures because I couldn't move. I couldn't get out of bed. I had to research about this. Then I had to read about it. The more you read about it, the more you understand it. Then at a certain point, you need to see a doctor. You need to see a doctor not because this doctor is going to give you something like over medication, no. But then some doctors are really nice to be talked to. You have this scoliosis. It's not like malaria that is going to be cured tomorrow or within 3 weeks. No, it's so gradual. The treatment is a little bit gradual. So I had to research about myself, and then until I found out that I had to do some physiotherapy, which turned to be a little bit expensive still, because you have to do it like on a daily in order to prevent pain. Physiotherapy, when you stop, things come back. And then, okay, at a certain point, it also helps you. It helps you in a way that it prevents the more curving, the curvature from increasing. So after that, okay, the thing is, pain was there, but I had to learn to live with it. Like, when it's not fine, don't force yourself to do something you can't do. I just used to handle just like that. Compliments.
Pain medication?
Oh, yeah, Brufen. Or any painkiller.
Okay.
Any painkiller, you just have to look for some strong painkillers. Yes, I just used to take painkillers, then I call it a day.
Okay. Or maybe Dr. Mtiara, now would be a good time to bring you in to explain to us when she says scoliosis, and that's what they told her, what exactly is it?
Thank you. Scoliosis really means a sideways bend, curve in the spine. The spine begins from the thoracic, that is the neck, the thoracic, that is the chest, and the lumbar, that is the waist. So that curve could occur anywhere along. It's a sideways curve, as opposed to a front curve, usually what we call kyphosis, and that's not what we are discussing now. Scoliosis is a sideways bend in the spine, abnormal bend, because it is normally straight. When you look at somebody from the back and you see the spine, it should be straight. When there is a lateral curvature, lateral means sideways, then there is a scoliosis.
Oh, if a child is born normal, because she says she was born normal, her mother says she was born normal, what then could have happened at the age of 8 when she started to feel what she did?
I think we need to first understand the various causes of scoliosis. The commonest cause of scoliosis is idiopathic. We don't know. Even when we investigate, we can't look for the cause. And the majority of patients are in that group, idiopathic, not known. 80% of the patients fall into that group. It's now the 20% who fall in a group where we can define the cause of the scoliosis. And apparently what has been described falls within the 20%. Now the 20%, they are mainly, this is a scoliosis which we call syndromic. Let's leave that term. But it means it is part of a disease process. It is only part of probably a manifestation. And they are what we call non-structural. Non-structural means it can straighten. When a patient bends, it can straighten. So it may cease. And the structure means there is simply a bone deformity now, and it will not easily correct.
So are we saying that we can tell why Zamzam got scoliosis?
Yes, now I can work backwards why she probably has scoliosis, because she hasn't been my patient. I've not investigated her. But the history is important. It can tell. There's a type of scoliosis which I need to mention that is called congenital, born with it. Born with it means there has been a defect in one of the vertebrae, the bones, the blocks that make the whole spine. Sometimes half of it is not developed, so then there is a bend. Now, it's not congenital. Hers is not congenital because she wasn't born with it. Most of the scoliosis progresses much more rapidly around the adolescent age because there's a bone growth sprout. Now, when it begins at 8 years, it means this is a non-idiopathic scoliosis. There is a cause. Now, the usual causes I talked about the non-structural ones. The usual causes are if there is a muscle spasm or an infection, for example, an appendicitis, or an infection in the chest, she had flu, or if one of your lower limbs is shorter, then you walk with the limb. So then this back starts bending towards the short limb. Now those are non-structural. They can be corrected if the cause is corrected.
So we're looking back at the surgery she had, the flu she had.
Yes.
That could have been something.
Yes, it was something. There was fluid. Now, I'm not going to depths of what type of fluid. Now, the structural scoliosis, that is the second type I talked about, usually follows a problem in the muscles or the nerves in patients like children with cerebral palsy. It also happens if there is a cancer, a tumor, a growth, or a defect. It can also happen in some genetic diseases like Down syndrome, but it also commonly occurs in infections. The commonest infection is tuberculosis of the spine.
How do you deal with it? If a patient like Zamzam comes to you, maybe at the age of 8 when it started, how do they then begin to handle it? Is there a way the course can be reversed before it gets to the level that it is now?
Yes. If the scoliosis is non-idiopathic, that is the 20%. If you take a good history, she's giving a good history, and then you do a thorough investigation, examination and investigation, and you get to the cause. Let's identify one common cause: tuberculosis of the spine. And if that is detected early and the appropriate treatment is given, it may stop the progression of the scoliosis. But nevertheless, since the majority have no known cause, you can't prevent, but you can control the progress of that scoliosis by giving a brace or giving a corset. A corset is something plastic, usually plastic. We give to patients, we put it inside. It's like a gladiator type of thing, but it is correcting, it's corrective. It is correcting the spine to come back to straight if possible.
Well, she says she wore a brace. I don't know if it helped. It doesn't look like it helped.
It didn't help.
Why would a brace not help if it's the kind that could be corrected?
As I've said, this is a kind which is structural, so there is a cause. there is a cause. So the cause initially had to be solved, and I don't have the full history.
Okay.
So I don't know if the cause was clearly earmarked and dealt with, or the body fought, because the body also fights. If the body fought and overcame the problem, now she remained with the deformity. Because the presenting features of scoliosis is the deformity. That is the scoliosis, the bend, which I've been explaining. The other presentations, which is not talked about, therefore she probably doesn't have, is as the bend progresses, it compromises the cavity in the chest, which houses the heart and the lungs. Now, if they become compromised, one may present with breathing difficulties or heart problems. Now, pain is not as a common feature, but if the cause, like an infection, causes pain, then pain is a presenting feature, as she has clearly indicated. Yeah.
Okay. Well, let's take a short break and we'll pick up from there. I'm interested to know if any of the things he said about, you said the lungs?
Lungs
and the
heart.
I'm interested to know if any of that rings a bell with you. Let's take a short break. We'll be right back. Welcome back. Thank you for staying with us. We're coming to you from the Athena Hotel in Bugolobi, and like I mentioned earlier tonight, we're speaking about scoliosis. Well, Zamzam, before we took the break, Dr. Mutiara was speaking about the feeling in the lungs and the heart. Did you ever feel any of that?
Oh yes. As far as the lungs are concerned, me is praying when I'm going for sujood. You just find yourself when you're coming back up.
What does that mean?
Going here like this, I made is praying, performing swala. You could find yourself, actually I always find myself, I feel like my ribs are cracking this side. That's the physical and everything. And then at a certain point, sorry, I lose my breath. Though it has taken some time now, some few months, I could just be sleeping and then I just find myself when I'm fighting to breathe. Like frequently, I could just start removing everything around me. I feel like maybe I'm not getting enough air. And then I could just fight with breathing. That's as far as the lungs are really concerned. And I went in at the lung institute. And then I conducted some.
You want to take a minute to take some water? Oh, and as you do, maybe Dr. Mutara, if she speaks about finding difficulty breathing sometimes, and also when she's getting up from prayer and there's pain, does that say something?
Yes, it says something. If she has problems in breathing, then there is an affection of his breathing system. It's affected, compromised probably, and then that's when we send her to a respiratory physician, to a physician who is specialized in breathing systems, and then there are measurements made of the air volumes in her lungs, and when she expires, the volumes that come out and those which are left, then it is interpreted as to whether it is normal or abnormal.
Okay.
So it says something.
Well, you said you went to the lung.
Yeah. Actually, he sent me to a certain doctor who referred me to the lung institute for some tests. So after taking those lung tests, I was told my lung functioning was at around 41%. And then, yeah, they just advised me to do some breathing exercises, like breathing in, breathing out. Like that maybe with time. But then I was advised to be going there annually. Then I go for checkup like that. And as far as the heart is concerned, I went to the Heart Institute as well. My heart hasn't been having any issues. It was only once when it was beating extraordinarily. Like, it was really hard. When I asked the doctor when I went to the Heart Institute, he told me, it's okay. Like, I have scoliosis. That should come in once in a while. But my heart, apparently, it doesn't have any problem. That was, like, it's supposed to be there. That's what he said.
What's the biggest threat for Zamzam or somebody like her?
In her situation,
Yes.
it's the biggest threat is the compromise on her breathing system. Because as she has said, if it's 41%, we need to ask the chest physician again what is the way forward. Does he think we should interfere and limit it? Limit the progression of the deformity as it is bound to progress, the scoliosis. If it progresses, are we going to decompensate further? And is it going to compromise her health further? And if he recommends that something should be done, then correction, surgical correction could be done on her spine. We call it surgical correction and fusion, so that it can't bend any further.
Okay, well, I noticed Zamzam's already bent quite a bit. Is that severe, or does it get worse?
What she has is severe.
So when you spoke about the bend getting bigger or more,
Yes.
you mean it can get even more now?
Yes, it can. It can.
So what's the plan, Zamzam?
The plan. I was told about the surgery. Like, going in for the surgery, as I had said, she's a little bit costly. But I can say it's inshallah. I don't know how. Okay. Yeah, you go, they think of your spine with those metallic things.
Okay, I don't know what the thingy means. Maybe Dr. Mutiara, you can explain to us.
Yeah. My colleagues have suggested that she requires surgery to fuse her spine somewhere else, not me. And this has been through measurements and working out the best way forward. And that then includes opening her spine, putting screws in we call them pedicles. There are certain parts in the spine, and then bringing a rod which is bent according to her shape. Then it is passed through, and then mildly but forcibly turned. And if something is bent like this, if you turn it, it becomes straight. So that's a procedure that they've suggested she would go through to correct. It can't be 100% correction. Some correction, because this is structure now. So some degree of correction, but mainly fusion, that is stopping it from progressing further.
Okay.
And then that rod in the screws is tightened, and she lives with it.
Yeah.
What's the prevalence when we speak about scoliosis? What's the prevalence for Uganda? Or maybe let's start with the world.
No, we don't have a prevalence for Uganda. We haven't done that study. But generally, as I said, most of them we don't know the cause. So you can't say what is the prevalence at birth, therefore does not predict the final outcomes of scoliosis.
And the general picture worldwide?
Worldwide, it's in a population. The incidence how many come up or prevalence at any one given time, maybe 1 in 25,000 in a population.
Okay.
Yeah.
How many have you seen anybody that's gone through this kind of surgery and what the quality of their life after it is like?
Yes, I've seen a number who have gone through the surgery and their quality of life is okay. I did some surgeries and the children have grown up. They're okay, they're at university. So once caught early, the prognosis, the results are even better. But even when caught late, the quality of life is better because then the fear of progression is ruled out. So it is a worthwhile procedure when it has been determined that there is a justification, there's an indication for that procedure.
It's a worthwhile but costly procedure, from what she says. What's the estimation for example, what that kind of procedure would cost?
I don't know, I think.
I don't know what they told you, Zamzam. What did they tell you?
They told me $15,000.
How much?
$15,000.
$15,000.
That's what they told me.
Okay, wow. And would this be done here or wouldn't be done here?
Couldn't be done here.
Where would it be done?
India, inshallah.
In India?
Inshallah.
Oh, okay. Well, let's take another short break and we'll be right back. Thank you for staying with us. Again, we're coming to you from the Athena Hotel in Bukolobi. And before we took a break, Zamzam was telling us that the surgery, from what you've been told, would cost about $15,000,
Yes.
which comes to about 55 million Uganda shillings.
Exactly.
Does it have to be India? You wouldn't know. Dr. Mutiara, does it have to be India?
Well, first of all, I want to say a patient has the right to choose which doctor and where, as long as the funds are there, the means are there. But that's not to say that on this program I will say that this can't be done in Uganda. It's a complex procedure, yes, and I respect her choice. I respect her choice of doctors and the place where she wants to go. But that's not to say that in Uganda it can't be done. But it is quite complex. Now, having said that, the figure she's talked about, I wouldn't dispute it. Because this is a multi-level procedure, many hours of surgery, maybe 6 to 8 hours of surgery. Some of the outside countries outside of ours, they calculate the cost of surgery per hour. The implants that are used there are quite expensive. They are titanium, and there are a number of them. They are expensive, and it's a multidisciplinary approach. You have to have a cardiologist, a physician, handy. They are not cheap. The surgery itself is not cheap. Not one orthopedic surgeon can do that. He needs another one. After that, the patient has to go to intensive care unit.
And we're not even thinking that the patient is going with a caretaker.
Yes, but I'll give you a comparison. People complain that the intensive care units in this country are expensive at the rate of $1 million, 1.5 per day. I've been to a country where intensive care unit site service per night, per day approaches $2,000 per day.
$2,000?
Yes. And that is the rate. So that's the rate she's going into.
Wow.
And we don't know how many days she would spend in ICU. Now, in case they were taking $1,500 ICU per day for a week.
We don't want to do the math.
Yes. So I can't dispute the figure they have given her.
Yeah.
But I've also made a statement. It's not that things can't be done in Uganda.
Okay.
Yeah.
Well, sometimes do you have any question maybe for Dr. Mtiaba?
Question for Dr. Mtiaba. Dr. Mtiaba.
Yes.
Sometimes I approach I call ourselves scoliosis warriors. Always approach scoliosis warriors. I find them, actually for me, approach anyone whom I see with a deformity in the spine. I always ask them, do you experience pain? How is your life? At a certain point, some of them are like, I don't experience any pain. The only problem I have is negativity from people. Because at the end of the day, when these spines have issues, you find yourself, when your growth is really affected. It's so hard to find it when you're very tall, when you're, in most cases, they are very short and tiny. So they are like, the only problem I have is the negativity, being called names and everything, but then they don't experience pain. Then I'm like, am I abnormal? Until I find another person who tells me, oh, things are not right, I'm not fine. Then I feel better. So what could be the difference between those who don't experience pain? Because at a certain point, you would feel like, I wish I was just like this, minus
The pain.
and minus the pain, minus anything. But then you have to deal with two.
Dr. Mtiaba, what is the difference?
Yeah, sorry about that. But as I mentioned earlier, pain is not the commonest presentation, except if there is some activity. The pain means there is either an activity, like an infection, or there is spine instability. It is shaking and moving. So it has not been fixed. Now, for the activity, I would need to investigate you, madam, further, given the history that you've given. I'm not confident that there is no activity of infection.
Mm-hmm.
That is paramount. Then, if we ruled out any activity, either infection or otherwise, then we would check the spinal instability. There are detailed tests, like when we do the x-rays, they have x-rayed you from anterior and posterior, and also done the lateral from side to side. Mm-hmm. Now we do a number of those detailed other x-rays. We do them bending and then extension. Then we do lateral bending right, lateral bending left. You get it? Then we determine the amount of instability. Then we say, yes, we must. If we fix this spine, then the pain is likely to go. We can't guarantee that everything will go. That is to God, for Allah to help you. But we hope that when we fix the spine and stop any activity, those are the causes of the pain you have. But for the majority of scoliotic patients whom you have said the warriors, the majority is idiopathic, no known cause, no activity, probably no instability. So there is no pain.
So the ones you've just mentioned, the ones with no pain at all,
yes,
they can live a whole life like that?
Yes, but there is a possibility of progression so that it could decompensate the heart or lung function, but they can live like that. But if it is progressing rapidly, still they have to be treated also, or we measure the speed of progression, they have to be treated.
Do you spend on a daily, maybe on medication? Is there an added cost for your daily living?
The added cost could be the physiotherapy, which I couldn't really afford, so I opted for painkillers. There is a certain doctor from Zambia, Dr. Mugisa, wrote me some nice painkillers. I always buy them in plenty, I always move with them. I take one daily.
Is there a risk, Dr. Mutiara, of addiction?
Depends on which drug, but doctors rarely give chronic pain patients drugs that will cause addiction. But I think it's a problem when you are with a patient who has not been fully your patient, or you know all the nitty-gritties. But I think an advice, Zam, is we all need to come together. Even in other countries this is done. It's a multidisciplinary approach, and we all agree what we need to, in the meantime, do for you. Because, as I said, I'm not confident about some parts of your history. We need, and we can't discuss everything on.
No, we can't.
No, we can't.
Did you have another question for Dr. Mutiara?
I don't have any more questions for him. I just want to thank him because, trust me, doctors are very sarcastic.
Is that so?
Yes. And then it's so hard to see them first and foremost. And then when you see them, many of them, they are very sarcastic. They always tell you, Zam, you see you're imbalanced. You expect the pain. Like, it has to be there. I can't do anything for you. Like, just go. I don't have anything, but maybe let me recommend paracetamol for you, nothing more.
They send you away.
Yes, and then he's different, and then the doctors he connected me to still, they are so different. And since I got to know him, at least.
What's been the worst thing for you about having this condition?
Issues with scoliosis, there are more. You get emotional issues more than the physical issues. So, at a certain point, I felt like, oh, calm down. One was scoliosis in our family. So at a certain point, you feel like, oh, Zam, this thing is all about you. Like, they have to inject in a lot of financial help because you have to see this and this and that. A lot of procedures going, like, and I've been a sickly kid since way back, since this surgery. So since then, finances have been moving so much. And then, okay, the negative, what people be telling you, that's very fine. With time, you get to understand. Maybe they were young. Maybe they are ignorant about something. At a certain point, they could throw negative comments. But I never used to mind them so much. Yeah, even at campus. But maybe they just don't know what goes on, like, in our lives. They don't know the issues. They don't know how we stay. They don't know that you can wake up one day when you're not fine. They don't know you can fail to sleep. They don't know. So you try and smile, You try and smile when you can, in order not to overcomplain, because at a certain point you might be very uncomfortable, and then you feel like, I shouldn't say this. People are really tired of hearing my everything. So I'm fine, because some days are good. You can wake up when you're so fine. Some days are bad, and some days are worse. But then you try and feel better. Anyway.
What has today been like? I saw you bending a couple of times.
Today has been bad. I don't know. I think another question. Cold days are really so bad for me. I really don't know why. But you find yourself when your neck is really hurting badly. So today hasn't been a good day for me.
Why are cold days bad? Maybe I can ask the question even as my voice finds its way from why has today been bad?
It so happens that when the weather is changing, patients who suffer from musculoskeletal diseases, musculoskeletal means muscles and bones, they get a change in the system, which may be, I don't want to make it very scientific, but there is an electrical circuit set up, piezoelectric, which now initiates some pain at that. So patients, like patients who have had fractures, some of them, especially of the lower limbs, will tell you today it's about to rain because she's feeling something. Or if one has a metal, may tell you today is about to rain. That's beyond much of what we can explain, but it happens. So I think that is the effect that she gets, which means it's probably some activity. I have talked about that before. But I also want to make a comment. Sorry about, I think the comment about doctors is strong, Zam. Although we are different
from high experience.
Yes, although we all have different hearts, but I believe all doctors, over 98% are practicing medicine because they have a calling for it. And that calling is optimistic, it's for the good, not sarcastic. Because if you're sarcastic, then you can't come to be a doctor. But I think the explanation for your perception is that, understandably, the statistics show the doctors are too few for the population. Too few. We even get embarrassed talking about the ratios when we travel. That means they have very little time, especially those in busy institutions. They have very little time per patient. And not only that, there is what we call a burnt out issue. If you come in when the doctor has seen 50 patients a day, you may not have enough time, and the hormone levels, adrenalines are up, many things. But they are not sarcastic. We apologize if you perceived it like that, but it's not so.
They are forgiven.
The doctors are willing to help.
Really, what would you like to say to us as we close? Your final remarks.
I would urge parents to go in for scoliosis screening for their kids as early as possible, because at a certain point I feel like maybe it wasn't because we were a bit ignorant about this. So I would urge people to go and then do some scoliosis screening before it gets worse, and then to thank Allah for their life. However much things are not well, but still, alhamdulillah, I can do something for myself still. However much I try.
What do you do?
I'm not working, but I plan on being self-employed, inshallah. Reason being, it gets a little bit hard on getting what to do in a way that, okay, you can't sit for a long period of time. You can't stand. When you wake up when days are bad, and then you needed a little bit, because after campus, some friends tried to get for me somewhere to work from, but then conditions weren't favorable.
I hope this program will be educational, so that the children who have scoliosis, or those adolescents where it is developing, can come out to the health units, be evaluated, and things are controlled earlier. The results are better the earlier the management is instituted.
And you say screening. Is there a screening for pregnant mothers before you have a child? Is it when you're younger? What does she mean?
Screening for young mothers?
She said scoliosis screening.
Yeah.
What does that entail?
No, the patient has to, when a child has an abnormality, a deformity, just take to the nearest health center. That's the screening, I think she means. Let the child be evaluated, or an adult. Because there are tests we use to determine whether this is scoliosis or not.
Right.
Yeah, the tests are prescribed.
Okay.
Yeah.
Thank you so much, Dr. Mtiaba, and thank you very much, Zamzam, for sharing your story, and Doctor, for enlightening us on scoliosis and giving us information we wouldn't otherwise have known. Well, that brings us to the end of our show for tonight. Coming up is MTV Weekend Edition.